All right, so we have the micro air liposuction unit, and we're doing a liposuction of her abdomen. She has had cool sculpting before, and I'll let her tell you how that turned out. How'd that turn out?
A nightmare. Awful.
The cool sculpting was a nightmare, and it left these hard, firm areas. So we're going to smooth them out with this liposuction. And you can see the fat coming out beautifully. And when I finish this, I'm going to do the Renuvion. And we'll get a video of the Renuvion. And now what this does, of course, the liposuction removes fat. But it doesn't really tighten the skin. And you can make it tighten the skin a little tiny bit by just taking the fat off the back of the skin. But the Renuvion really tightens the skin. So people like her, she could have used a tummy tuck, but she's going to do fine without a tummy tuck. And she won't have the complicated, well, the tummy tucks aren't that complicated anymore, but she won't have hardly any recovery time with the Renuvion. And so that will tighten her skin. And here in a minute, we'll stop the video right now, and here in a minute, when I get this whole thing liposuction, I'll show you a bit about how the Renuvion works.
Okay.
We have 650 cc's of fat. We took on the local anesthesia, and take a look at her wonderfully flat abdomen now. And now we have to do the Renuvion. You can take it from further back. There you go. And how much did that hurt?
It didn't.
Didn't hurt any?
Just felt pressure and pulling.
So, all right. Thank you very much. Okay, so here we go. This is the way her abdomen, demonstrates the looseness of her abdominal skin right now. So we're going to show you what happens. Let's just say we'll do the Renuvion first on this side, and then give a comparison with this side and this side. That's good. Thank you. Your own?
Yep.
Can you see the light there?
It's hard to see.
Turn that other light out. See it under the skin? We make about 6 or 8 passes. And trust me, this will tighten the skin. And you get 25% of the tightening today, right here at the table, which I'll show you. And then the rest of the tightening occurs as collagen is being made over a period of, they say 6 to 9 months, but I've seen it even tighten after that, tighten even more. And what this is doing is tightening the little connections between your skin and the underlying muscle. People haven't ever thought about those before, but think about if you didn't have those little things connecting your skin to the muscle, if you stood up, your skin would fall off on the floor. I don't think anybody would like that much. And so this tightens those little tiny things they're called microfibrils. They shrink them up. And so it's kind of like shrink wrapping your skin, actually. And I'll go all 3 layers. I don't get too close to the skin. So there's no risk of actually burning the skin. It's a little bit too deep to do that. But that's good. You can just turn.
Okay.
Okay, now we've done the Renuvion on this side. So I'm going to just pull this skin up. And you can see how it's tightened the skin. And then this side, you can see how that is very, very loose. And I'm trying to put the same amount of pressure, but you just about can't get a hold of this side right here to pull it up. I think we're done on this side. Maybe a little bit right here. I think I need to do that a little bit more. But that's incredible, isn't it?
Okay. Here we are.
There she is. And you can see this is really tight now. That's really something. And that's it.
Okay.